So Dr. Goldberg loves her Sauvignon Blancs, and this is one of her favorites besides the Kim Crawford's, but the Whitehaven. We're going to give a little shout out to Whitehaven Wines.
Thank you, Whitehaven.
Yum! We love it. And today's topic
is fat. And more specifically, volume. Fat transfer and fat grafting. So this has become one of the more popular things people want. Obviously, you cannot mention this trend without mentioning the Kardashians and the BBL.
The Brazilian butt lifts.
The Brazilian butt lifts.
That's what most people know it by.
Absolutely. But there are so many more places in the body that patients have asked us to use fat and that I've started to learn you can use fat. So I think maybe it's a good idea to start out a little bit of detail about what that procedure involves for people.
What is a fat transfer?
Yeah, so a fat transfer quite literally means you're taking fat from one part of the body and moving it to another part of the body. The procedure really is called fat grafting because it is a graft. Graft means you're taking a piece of tissue off the body. It no longer has any direct blood flow from where it came from.
Right.
And you're putting it somewhere else
that it wasn't before.
And the important distinction in that is it has to grow a new blood supply and get new blood vessels going to it for it to survive. So when we take fat and liposuction it from somewhere and put it somewhere else, it takes a couple of weeks for that fat really to kind of grow into that area and become permanent. And it really isn't even permanent. It's definitely much longer lasting than fillers.
That's a big question.
Just like everything in our body changes over time, over 20 years, you will lose a lot of fat in your face, in your, legs, in your buttocks. You usually gain it other places, but that's true of the transferred fat as well. It will gradually go away over time to some degree.
So I think let's dive in like step by step, kind of, because we know fat can kind of be in a bunch of different, we'll get to where all the areas you can transfer to.
Sure.
Let's talk a little bit about, a couple things, safety of it. Exactly what are you doing when you're doing it? Are you let people know we're doing liposuction, then what are we using what are we doing with the fat once we get it?
Absolutely.
And how are we injecting it?
So fat transfer can vary from a 30-minute procedure under local, where we numb up a small area of fat by the hip or the thigh or the tummy, take a little bit of fat out, maybe 20 or 30 milliliters, like a shot glass. And then we use it in small amounts for, say, the under eye area or cheekbones or something where there's a small volume. So sometimes procedures like that can even be done under local anesthetic.
Right.
I find people are more comfortable with a little bit of sedation on board, though.
Yeah.
The other extreme end of that is full body liposuction, where you're taking all the fat you suction from the whole body and putting it back in. Now, legally, unless you're in an actual hospital and staying overnight, you are not allowed to suction more than 5,000 milliliters.
That's a very good point for people to know.
Yes.
It's a good question to ask surgeons when you're going to a consult, too.
Yes, and I work with a group of anesthetists that go to multiple cosmetic offices. They've been around for 20, 30 years. I know for a fact there are surgeons that break those rules, fudge the numbers on the reports, and they take 6, 7, 8, 9 liters of fat and they put a lot of it back in.
Right.
It may give the look someone wants, but it's not safe. There's a reason they have those laws in place. So you do want to be kind of careful about how much of this you do. Just because you can do something doesn't mean you should.
Right.
So between those two extremes are my typical fat transfer cases. I do a lot of fat transfer to the face, to the breasts for cleavage, and to the bottoms. I've also done fat transfer for people who've had liposuction where it's indented and a little uneven, and we've done some things to the back of the hands, but the common ones are face, breast,
and it originated in our practice from breast reconstruction.
Breast reconstruction.
From breast cancer patients really constructing breasts. That's really, you started there and kind of provided elsewhere with it.
Absolutely. Because for some of those patients, the problem is even with an implant in, that doesn't look like a natural breast. There's no tissue in the cleavage or upper pole where people really want it. So I got a lot of experience, taking fat. Nobody's ever sad to get rid of some of their fat. And putting it where people wanted a little enhancement.
Right.
And to me, that is really still how I prefer to do fat transfer to the breast. I like it for contouring, for shaping, for improving cleavage. I don't like it for volume.
So let's stay on that for a moment, because we have a lot of patients who come in and they're like, well, can't I just use my own fat to augment my breast and enlarge them? And there are people who really do kind of focus on that in other practices where they will kind of say that they're going to give an augmentation with fat. And you were just telling the story before we started about a lady they were following her on her journey
on Real Self,
and how things just kind of started getting worse and worse and worse by the day when days went on.
Yeah. So there's a certain amount of fat, capacity-wise, that your tissue and your skin can hold before the pressure becomes so much that it kind of cuts off the blood flow, the same way wearing a super tight pair of pants would cut off blood flow.
Right.
And there's also only so much healthy tissue to put the fat in between. If you put big, huge globs of fat in, it's not going to be able to grow blood flow. They've shown in studies that it has to be a centimeter or less in size for blood flow to really be able to get to that whole piece of fat. So if your surgeon is shoving 1,200 milliliters of fat in each buttock, there's not always a lot of space for that to go, and it looks great for a couple months, and then all of a sudden some of the volume starts to go away. Either your body metabolizes it and digests it like it's an infection, or it can turn into hard lumps and start draining. So to minimize the risks of that, if you really do want to go crazy with volume, you just need to stage it.
Okay. So doing different sessions. So do one surgery where you kind of can get that volume, know how things are, how much fat takes.
And I wish I could give people a number, but everybody's body's different. Everybody has a different amount of tissue in each area. If you've got a lot of buttock muscle and a lot of stretchy skin, you certainly can fit more fat than if somebody's really thin and they've got a really tight skin envelope already.
Right.
So it's very individual per patient, but I really rarely like to transfer more than 500 or 600 cc's of fat to one particular area.
Right. Let's talk about the longevity of these really big Brazilian butt lifts and like what can happen, and really ultimately, because within the practice you love to do it for contouring. You love to make beautiful heart-shaped, round, get rid of the square, and just really more of an aesthetic of it, just to make it really pretty, not versus really enlarged.
Well, most of our patients don't really want.
And they don't want that
big butt.
Right.
They just want one that's more shapely or a little higher,
right?
Or looks a little better in a bathing suit,
right?
So
or fits in jeans better.
Or fits in jeans better. So when you're talking about BBL, believe it or not, about 70% of the shaping comes just from doing the liposuction.
Right.
If you're lipoing those love handles and the triangle above the buttocks, you really get a nice sway in the back. You can lipo around the thighs and really create more of a shape. And then to me, I only like to put fat back in, and only in an amount that kind of completes the roundness or creates the shape that that particular patient's looking for. So you're using
the flanks and the body to bring in the waistline, and then kind of use a little fat to kind of bring out the curve.
And some people want their butt to be more curvy than it is. Other people just look at their butt and see, well, there's a nice curve here, but there's almost this divot at the top or a dimple, and they only want fat in those areas. So it's a really big distinction. They're all the same procedure, but they're really different. If
you did want to go, though, and get one of these really large Brazilian butt lifts, which is really a lot of the trend, is this corset cinching waist and then this really voluptuous bottom, what's that like years and years down the road?
Well, let's talk about two things before we even get to years down the road. That look is very popular with some patients, but many people have to realize you can't always get a super narrow waist and a round bottom just from liposuction.
Right.
If your fat is within or under the muscle layer in your abdomen, visceral fat, we can't take that out with lipo.
Right.
And also, to get that really pinched in curve, many of the girls you see on Instagram and posts are using waist cinchers, waist trainers for months at a time in combination with their surgery. So it's really not just a surgery that's doing it.
I wanted that to be clarified.
Absolutely.
Because it is a huge thing trending all over.
Absolutely. And some people love that shape where it's as narrow as it can get and it's fuller. That's not what bodies usually look like, so many times there's more than one step to get to that place.
Right.
Now, we've already talked about some of the complications. If there's too much fat, it can get infected and drain out. It can turn into hard lumps. But even if everything goes smoothly, if you've put in enough fat to not just fill out the looseness of the skin that's existing, but to stretch the skin even more, if you get later reabsorption of that fat, or in time when you just get kind of sagging your tissues because you get old, I am really interested to see how many dimpled, cellulite, really saggy down to the mid-thigh butts we're going to see in Hollywood in about 20 years.
Yes, yeah.
I don't want to call anybody out specifically, but I did see...
No one's really thinking about that stuff.
No, but I saw a picture of Amber Rose and Black China on a treadmill. And as a surgeon, I just kind of thought, what's that going to look like in 25 years? I mean, they might like the way it looks now, but it's unknown because this is a newish procedure.
Right. Right.
So if you kind of want to go down that road, you just have to realize we don't really know all the implications of this
later,
with these large volume fat transfers.
Right.
Small volume fat transfer has been done for a very long time. It's been studied extensively.
Mm-hmm.
There's a guy, Sidney Coleman in New York, and Roger Corey in Miami. They've written a lot of research about it, and they know if you're looking for just a breast dog, there are people who do it like them.
Right.
But they tend to take 8 to 9 hours doing a surgery.
Explain that why, because that's a big thing, because, you know, we talked about this one time when we went down to Baker Gordon in Miami to one of the conventions, and we were talking about, you know, how amount of time of a surgery and how much volume's being put in, and the dangers of having a very short surgery and how much volume's going in, how long it really should take to do these kind of volumes.
So Sidney Coleman, who kind of pioneered these techniques, puts in about 1 milliliter of fat at a time in any one given location. He does mainly breast, well, a lot of breast.
Right.
It will take him 8 hours to get somebody a cup size or two larger, because he's very fastidiously, you know, he's processing his fat to get out all the impurities in the blood and all the extra liquid.
Right.
Then he's putting it into very small syringes and being very careful about where he injects it in the tissues to make sure that it's all spread out evenly and that it's going to get good blood flow.
Right.
Because remember we said anything bigger than about a marble sized or a centimeter, the center of that's not going to get blood flow if it's put in a bigger chunk or injection than that. So,
and I had someone ask a question, and not to backtrack or anything, but Jessica asked, what is your opinion on waist trainers?
So
good question.
I don't really have a position on waist trainers, except that you shouldn't do it immediately before surgery for a very short time, because it can change the way your lungs expand, and it may make you have breathing problems after surgery, especially if you're in pain after surgery. And I wouldn't do it immediately after surgery until you're sure your lipocytes have healed. It may be 6 months before it's a good idea. You don't want boning and marks in your lipocytes until you're fully healed from that.
Now, I think I touched on that again for her. Do you recommend that if one of our patients was wanting really that cinched in waist? Would you say this might be a good thing to add into the equation?
Well, it depends on their anatomy to begin with.
Right.
Some people already have a fairly narrow waist, but there's a lot of external fat, and for them, we don't need a waist trainer. We'll just do the liposuction, put some fat where they want it, and get the result. But there are patients who either need to lose a bunch of weight to get their intra-abdominal fat down, or use a waist trainer. Yeah, I'm one of them. I will never have a cinched-in waist, you know, with a huge butt.
Tell everybody what you're brought to us by. I love this.
Oh, the letter H. I just go straight down, and that's fine. That's fine. But for me, if I were a patient saying, I want this cinched-in waist and bubble butt, as a surgeon, I would tell myself, I'm sorry, you're not going to get that from surgery.
Right.
And you're probably not even really going to get it from a waist trainer either.
Right.
So some of it's understanding your body and what's possible.
What's realistic.
And realistic, yeah.
Right. Hopefully that answered that.
Yeah, no, definitely.
And where were we at? So the other thing was...
Well, we were talking about the speed of fat transfer and how long surgery should take.
That was a big thing. Mm-hmm.
So these guys that are putting in fat in very small increments take hours and hours to do fat transfer.
Right.
A lot of the places that are offering these at really discounted rates are cutting corners, and they will suction fat out at a very rapid pace, and they use a very large cannula to literally just reverse it on the liposuction machine and what I call plow the fat back in at 300 milliliters a minute.
I want to stop you right there, just for people who don't understand.
Sure.
So you're suctioning out, you're plummeting it back in. The normal thing to do is...
So normally, once the fat is suctioned, it's a good idea to keep it in a closed system so it's not exposed to a lot of air. So reversing things through the tubing and having it come from the lipo tube, you know, the lipo cannula, into the tube, into a canister, and then straight back through that. That's not a bad idea. But when you're doing it at 300 to 500 milliliters a minute, you're not able to as easily control where that fat is going.
Right.
And I remember sitting at the Baker Gordon conference last year, and there was a surgeon, a very prominent surgeon, demonstrating BBL using this technique, and about half the audience was literally gasping, saying, I would never feel safe doing that. Right. And he just kept saying, well, I know I'm at the right angle, I'm not going to do anything. But the rate of death from BBL is higher than any other procedure in plastic surgery. Right. And it's not the procedure itself. It's cowboys doing the procedure like that, trying to maximize their revenue by sucking it out, cranking it back in instead of taking the proper time to do it safely.
Because they take a long time. And a lot of people, I mean, get very sticker shocked, especially, I mean, our BBLs tend to be a lot more because our time under anesthesia and OR is really what calculates a lot of the price, but that's the way it should be done. You know, it shouldn't be
that's the only way I'm going to
do it. A race against the clock.
Because I don't want... You know, we had a patient a couple of years ago who was considering getting BBL with us, went somewhere else, and unfortunately she passed away of a complication.
The hardest thing our practice has ever taken on.
All I remember her saying is, well, I would love to go with you guys, but their price is just so much better. But there's a reason if the price is that much better. Right. So this is one of those procedures you definitely don't want to take a gamble with. Yeah. Filler, go for your Groupon. Botox, whatever. Yeah. Not a big surgery like this with a pretty high complication rate if it's not done right.
Right. So we've done face. We've talked about breast for cleavage, contouring, you know, even for people who do a reduction or a lift and just can't get that fullness up to the area, and the BBL. Is there anywhere else you could do fat grafting?
Labia is the only place I forgot to mention so far. Probably because
we are going to
no matter how much we do it, it's still weird to kind of talk about.
Ton of vaginal rejuvenation in our practice, and we will dive into that and we will discuss it because it is one of those hush-hush topics a lot of people don't want to talk about, but you would be mind blown to know how many people walk in our door. Yes. It's one of the highest procedures in our practice that happens, and it is not because people want to look like a playmate or they want to look like something they saw on TV. It is a legitimate concern, and it's a legitimate issue that people have. But one of the things that they have is deflation of the majora area down there. And people can say it's saggy, it looks like deflated, it looks wrinkled.
It doesn't cover the menorah anymore. Right. There are lots of different things I hear from patients. I'll be honest, it's not as popular as a lot of other procedures because so many women wear tight bathing suits and yoga pants that they'll take a wrinkled labia over a full labia that might look obvious through clothing.
Yeah, that's not the biggest part of our vaginal rejuvenation.
But it is
surgeries.
possible, and I have done just small amounts for women with just a little bit of fat loss where they feel like if it just looked a little more plump, it would look a little more youthful.
Yeah, that's definitely on the lower totem pole of our vaginal rejuvenation surgeries. But two other things I want to touch base on. Hands, things like that. And then the other one is on the new kind of cutting edge of things is the fat syringes that we've just taken on.
So that's there's two things I want to talk about. Renuva, which are the fat syringes, are one of them, and the other is Nano Fat. Right. So Renuva is related to some of the allografts and slings and products that we've used for breast reconstruction. They're basically tissue-based products, meaning they get a layer of tissue from a pig, a cow, usually human, but they process it in a way that there's no more living cells. There's no living particulate matter of that product. When it comes to us, it is a powder in a syringe, and it's essentially a mixture of growth factors and remnants of stem cells that will, once mixed with liquid and injected in the body, stimulate your body to grow new fat cells in that area. Right. So that's wonderful for patients who really don't want to undergo the lipo part of it, or don't have enough fat. The problem with it is expensive. It's tissue. It is about $2,000 for a 3 milliliter syringe, but for someone who has a very small deficiency in fat in their face or somewhere else, it's very upsetting to them, or the breast, where a small volume is going to fix it. Right. It may be a better choice than undergoing surgery. Right. And the results are essentially permanent. The FDA studies aren't long enough to say that anything is permanent, but they're a couple of years in, and by that point, it's about the same thing. Is there anything like that where your body could reject it because it's not your fat, or...? Well, because there's no living matter in it, there's nothing for our immune system to react to. Right. It's not a living thing, so our body can't reject it. Absolutely. Now, does that mean all of it's going to survive? No. Again, it all depends on how your body reacts to something being injected. Right. Some people, when they have surgery, get very swollen. And a lot of people don't know this, but the blood vessels only go so far in our tissue. For oxygen and nutrients to actually get to our cells, they have to basically diffuse out of the blood vessels across our tissue into the actual cells. Even a small amount of surgical swelling can interfere with that process. Right. Smoking interferes with that process. Right. Sitting in pressure interferes with that process. So we can never promise or guarantee how much volume someone's going to retain from fat grafting because it's just too individual. Right, right.
And a lot of it depends on their care at home too.
Absolutely.
Post care, Brazilian butt lifts, you can't sit on the fat,
Yes.
and things like that. So it is a lot to do with how they take care of themselves on the follow-up end of it.
And in general, about 50 to 70% of fat stays, but it's really body part dependent. I would say for breast, honestly, unfortunately, it's probably less than that. Probably 30 to 50%.
Why would you say that?
Just out of my experience with patients and what kind of volume, and not even just my patients, I'm fascinated with fat transfer to the breast as a procedure because honestly, every woman would rather avoid implant complications and not have an implant.
Right.
But time and time again, when I look at the results, they look fabulous at 3 months. And then by a year or two,
it's a whole other story.
It's not that different than it was pre-op.
Right.
So for small areas, the rate of take is higher because you're asking less of the body.
Right.
So for small areas like cleavage, you do see a persistent difference. But for global size, in the breast especially, it's just not been as impressive as I want it to be before I'm going to talk to patients about doing that.
Yeah. And another thing I was just thinking of also when you were going down that, it was we've had a lot of patients who've come in who've had prior liposuction from other surgeons. And you mentioned it briefly at the beginning of it, but it was like contour irregularities. That fat grafting is really good for that. And people think that's crazy. Like, I lipoed all this fat out and now you're going to put fat back in. But for those areas where you have a little asymmetry on the thighs or in the abdomen where there might be a little contour on this side, but those are times where we have used it to help contour that area.
So for kind of, I don't want to say botched lipo because it can happen even with talented surgeons and compliant patients.
Right.
But for lipo that just doesn't turn out the way you want and there's skin puckering and unevenness, a lot of times just going through and doing some liposuction and laser techniques can kind of break that up and even things out. But if there's a true divot or kind of a volume hole, and I've seen some patients, I had one patient who had one in her buttock from a shot. That she got a blood, like a hematoma around it, and then it went to a divot.
Well, I had that big divot in my butt.
Well, yes, you did temporarily. And we talked about
from a
shot
shot
there.
From a shot. No,
so for little things like that, it can be really helpful. And I do want to touch on Nano Fat because it also ties into
No, that was definitely the same.
So Nano Fat is a pretty new concept in fat transfer. It means that we are breaking down the fat into basically it's molecular components. It's not a live fat cell anymore that's going to go into your tissue and grow and just be there. It's more like the Renuva product where we're injecting growth factors and things that will stimulate your body. So places where we wouldn't traditionally put fat, scar tissue, eyelids, I mentioned fat for the under eye, very specifically, it's safe to put fat over the bony part, not real safe to put fat right in the eyelid.
Right.
But if you're using the Nano Fat, it's processed in a way where it's broken down so much, it's much more liquid.
I think people are still asking what's Nano Fat exactly.
So basically, what you do, you take the fat out of the body, you put it in a syringe, you connect it with a lure lock, it's a little connector, to another syringe, and you squish it back and forth a bunch of times. Then you put a little filter in there, and you squish it back and forth a bunch of times. And then you put a smaller filter in there until it's down to 400 micrometers. So that's Nano Fat.
That's Nano Fat.
It is a liquid. It looks kind of golden color, and you inject it with a syringe just like you would inject filler into the skin and into superficial areas.
Right.
So it's a real breakthrough for us because we didn't used to put fat in superficial areas.
Right.
It would feel lumpy bumpy and it might not take. So this is kind of a new thing. The only problem with it is not instant gratification like fat transfer.
It's a stimulator.
It's a stimulator, and it can leave things a little bruised and a little inflamed looking for a couple of months while that process is happening.
So it's very important.
It's a game of patience. Yeah. So these procedures are not without risk and without trade-offs, and I really just hope to impress upon people if your surgeon is sugarcoating this and making it sound like it's going to be a walk in the park, just ask more questions, because especially with full body lipo and BBL, there's a chance you could have a pretty tough recovery for 2 to 4 weeks.
Yeah, I don't think people even lipo gets so sugar coated.
It does, and even for me as a procedure, I think, we'll just go in, we'll suck out the fat, we'll be out, and it'll take me an hour. But then it takes me 2.5 hours, and then patients are sore and stiff for 3-4 weeks afterwards, where they kind of pictured 3-4 days.
Yeah, I mean, I've been with you since the practice started, and I've been with patients nonstop. I've seen everything in and out until I had somebody personally that very close to me had liposuction, and I got to experience one-on-one like day one and all these things, and it is rough. It really is rough. And so I think we try to explain it the most, but patients who come in and get these full body contourings and all this stuff, it's a pretty long recovery, you know.
Or at least it can be. There are some people who sail through surgery and do great, but you can't.
They're
You
the far
can't
in the
know
few.
that you're that person ahead of time, and it's a very small part of the bell curve that's way at the
We
top.
had a patient today who wanted to do full thigh lipo, and she was, in management and retail on her feet all the time, and we explained, she would need time off at least a week, maybe 2 weeks if we're doing full thighs.
Yeah.
And she's like, I can't fit that into my lifestyle, and she'll end up doing what we call sculpture. We talked about it a little bit, a non-invasive fat removal here in the office, and it doesn't have any of the downtime. So you definitely have to want to ask the questions of what's going to be fitting into your life with all these kind of procedures.
I think that's one of the big things is know that there are multiple options.
Yes.
Some may not give you as powerful a result, but if they're less risky and they fit your downtime better,
Right.
it might be a better option.
Right. Yep. I think that covers all fat grafting. Melissa, we think so?
Yeah,
Got it all?
I think you're pretty on point with everything. No, definitely.
And Melissa, will this be going on? Will we be starting up posting on the video streams and?
We will. It will be everywhere and anywhere for anyone's heart's desires to watch.
So instead of just having them in the lives, we'll have it up and running.
And definitely, if anybody has any questions about any kind of procedure, just send it on in. We'll answer the best to our ability. And if you have any topics you want to discuss, definitely reach out and we'll talk about those for the oncoming Wednesdays.
That's our little Melissa behind the scenes.
All right.
Thanks, Melissa.
Thanks, guys. Thanks for checking
All right,
in,
now
seeing
to
us.
the
We'll see you next
unofficial
Wednesday.
Wednesday.
Yes, to the unofficial.